Buenos días, colegas. Bon dia and good morning, everyone. Bienvenidos.
Good morning to all of you, and welcome to this regional webinar organized by PAHO in coordination with civil society on tuberculosis in the region of the Americas. It's a webinar on the second meeting, high-level meeting of the United Nations on tuberculosis, translating the commitments into action. It's a conversation with the civil society on tuberculosis in the Americas. And we want to remind you that we have interpretation into English, Spanish, and Portuguese. So you can select the language of your choice. As you know, we've reached 6 months since the high-level meeting of the United Nations on tuberculosis. The second high-level meeting on the fight against tuberculosis, the countries of the world, the high-level representatives reaffirmed their commitment against tuberculosis, and they also made ambitious suggestions of what to do for 2024 to 2027. We know that we have to accelerate the response to reach these goals, and we know that civil society and communities play a significant role to achieve this goal. We remember that in May of last year, we held several webinars to hear comments from civil society in the region to report for the high-level meeting. And with that work, we reported worldwide, but it also helped us prepare our position, our joint position with the Civil Society of the Americas, which our colleagues, Pieta Borra, Alberto Colorado, took to the hearings of the interested parties that took place last May that helped to inform and prepare the agenda. Now we want to continue our conversation with the Civil Society of the Americas and see how we can accelerate the response to achieve those commitments and the role of civil society here. Again, welcome to all of you. And I'd now like to give the floor to Dr. Belkis Martelino, who's a technical officer on TB here in PAHO, who will talk to us about the objectives and the agenda of the meeting. Belkis?
Buenos días. Quisiera confirmar.
Good morning, and I want to be sure that you see my presentation. Yes, we do. Very well, thank you very much. And as Pedro was saying, this is a webinar to review the commitments of the high-level meeting after 6 months. We're meeting today and have invited civil society and the national TB program for this conversation. Let me remind you that at the high-level meeting in September 2023, which is the second high-level meeting in September 2023, it spoke of translating the commitments into action. The heads of states presented a second declaration. And today, we're going to talk about the main recommendations. And amongst the objectives of today's meeting, we have a review of the advances regarding those commitments assumed at the political high-level meeting of September 2023. To present the document published in October of 2023 by WHO, which speaks of guidelines on the participation, the significant participation of civil society to put an end to tuberculosis. And finally, speak of lines of action to strengthen civil society's participation in the region of the Americas. Today's agenda includes this first section, which is the introduction, where we're presenting the content of the webinar. Then we'll have a presentation of the commitments of the high-level meeting, as well as the guidelines in the document published by the WHO in 2023. We have a very interesting roundtable where we're going to be reviewing the commitments and proposals for action by members of civil society with 4 different points of view. We will see the political incidents, advocacy, the community services, the experience of Engage TV, and finally, we're going to hear Ezio, who's going to talk about the main challenges of these commitments and proposals of action. And finally, we'll have some 15 minutes for discussions where you will have a chance to make comments, questions, consultations, and we'll end with the main lines of action to strengthen significant civil society's participation in the region. That's our agenda. And I'll end here and give the floor to Dr. Pedro Abedillo, who will make the presentation of conclusions and presentations of the high-level meeting and the presentation of the document we are translating into Spanish, guidelines of community and civil society participation to put an end to tuberculosis. Pedro, you have the floor. Thank you very much, Belkis. And I'm going to share my presentation. Let me know if you see it. Yes, thank you. As Belkis was saying, we're going to briefly, because you already know the commitments of the second high-level meeting, and briefly what the region is like regarding these commitments and the general situation, and this new guideline on communities and civil society participations to put an end to TB, launched end of last year by the WHO. As we said, you know the main commitments that we have on the high-level meeting. Contrary to the political declaration that we had in 2018, in this new declaration, we have some goals, some numeric commitments of coverage, so that by 2027, we will have achieved our goal, following up progress in the countries, following up the regional and world progress. We talk about coverage of treatment reaching 90% by 2027, that all persons diagnosed will have as a test, rapid molecular test to begin treatment, to achieve treatment and preventive coverage of TB of up to 90% by 2027, and also coverage of the social and health services for persons with TB, coverage of 100%. There are other commitments, other goals worldwide, like the question of financing in the TB services and in the research. These are worldwide goals. These are a bit more ambitious than we had in 2018, which were not achieved. So now we have to recover all we didn't do before. And a very concrete commitment to make sure that by 2027, we have a new vaccine and certified so that we can use it in TB. Aside from these numeric commitments, we have other very important commitments, which we're not going to define in detail, but we're going to talk about the general areas. On the column on the left, you see the accountability issue, adoption of the multi-sectoral accountability framework of the WHO, also to take advantage of the synergies between the world agendas on TB, as well as the whole coverage of universal health and preparation for pandemics. This year, for example, we'll have the high-level meeting on antimicrobial resistance, and we have to make sure that that will be used as well to promote the TB agenda. And also commitments regarding the strengthening of approach to tuberculosis during health and humanitarian emergencies, which we're having more and more. And the declaration also speaks of the priority of caring for the needs of vulnerable persons, including children, to deal with the TB crisis resistant to medication, to continue implementing the sensitivity test and the shortened programs of surveillance, secondary effects of the new drugs. And one final recommendation regarding the role of WHO and the preparation of a follow-up report for 2027, so that we can have the follow-up meeting in 2028, the high-level meeting for follow-up of what's been achieved. You also know, as you see here, we've extracted the main commitments related specifically to tuberculosis, where it speaks specifically of communities and civil society. These are the paragraphs where they are mentioned. We know that the political declaration underlines the need for civil society participation. We often mention this, and it shows that heads of state recognize that the civil society's active and significant participation is indispensable the persons affected and the vulnerable people is key for this. There were several commitments that include references to civil society's participation, like the continuing to support in the accountability, multi-sectoral accountability framework, the strategic national ambitious plans with active participation of communities and affected persons, and also to advance in the integration of TB services into the primary health care services, including, of course, the community health services. And the last one, paragraph 78, which is to reinforce significant civil society's participation, parliamentarians, communities, and most importantly, to increase and maintain the investment. In other words, get sufficient resources to achieve that significant participation of civil society. As I said, some data about the current situation of tuberculosis in the region. We see how we've advanced. On the charts on the left, you see the progress attained in the high-level indicators of the TB strategy. Above the incidence, the number of cases per 100,000 inhabitants, and down below, the mortality, the number of deaths by tuberculosis. The red line shows that we've advanced. And in green, it shows where we should go in the next coming years to achieve the cornerstones and the ambitious goals. And we know that there's been an important impact of COVID. We're recovering, but in 2022, we were still seeing an increased incidence and deaths, which was very alarming. On the right, we see a distribution in the countries of the region from greater to lesser as far as incidence of tuberculosis, estimated incidence. We know we have 3 countries in the region that have a very high incidence of more than 100 cases per 100,000 inhabitants, and a significant number of cases, 14 of them in fact, who are below the threshold that we call low incidence of 10 cases per 100,000, which could be the importance of achieving elimination. But most of the people with TB are in those 22 countries that we call moderate burden, between 11 and 60 per 100,000, which are the countries that could advance quickly to low incidence using all the tools we have available. And here we see the region using this cascade view with the main steps of the cascade. On the first column, we see the estimated cases, 325,000 persons with tuberculosis. The second column is the diagnosed cases of approximately 74%. And here we see the first gap of the goal we spoke of in the high-level meeting, which should be 90%. That means we're not diagnosing 86,000 people with diagnosis, and we know that most of them belong to vulnerable groups of population. Persons living in prisons, contacts of persons with HIV, persons living in poor areas, and other important vulnerable populations in the region. You also know that we have the diagnostic scales with the rapid molecular test of 100%, and you see that in the third column, only 40% of the people diagnosed are being diagnosed with these tests. We have a significant gap there because these tests will help us diagnose early and start treatment earlier and make sure of a better response to treatment and cut transmission. And the last pillar in blue shows us the people who were successful with the treatment. Only 70% of the people that were diagnosed were successful with their treatment, and the goal is 90%. So that's another significant gap. And another important aspect is that at the end of this cascade, it shows that some 50% of the people that we are estimating with TB in the region are not receiving treatment or are not successfully completing the treatment. So the gap is quite large and requires work. And what's positive is that we should think that we have many opportunities, many technologies, and many innovative technologies that could help us close this gap quickly. Here you can see the priorities that we're proposing and promoting at PAHO to accelerate our road towards elimination. You know that we're promoting the screening, the active search using the digital X-rays, we now have the possibility also of having that software of artificial intelligence, which helps us detect them quicker and much closer to where the people are. And another important thing is that we use the rapid molecular test for diagnosis. We have to focus our active search in those places where we know we have the TB cases, the vulnerable population, the hotspots, and to focus on those interventions, we need information systems, strong electronic information systems, so that we can actually detect where the problems are and focus our resources there. Another important thing is the search for contacts and preventive treatment in the risk populations. This is fundamental, and we know that it's not being fully used or valued. And we believe that civil society could play a significant role in accelerating the implementation of these fundamental interventions. Shortened treatments for the treatment of tuberculosis as well as for preventive treatment. We know that we have much shorter regimes and the need to advance in the implementation of community support intervention and social protection to improve the results of treatment. And quite significantly, the multi-sectorial aspect, of course, with the significant participation of civil society and communities which is precisely the reason for our meeting today. And now, what I'm going to present is the document which we talked of, the one launched by WHO November of last year. These are the guidelines on civil society and community participation to put an end to tuberculosis. I'll tell you that the Spanish version is almost completed. We hope soon to have it ready, and we will send it to all of you. Some quick comments on the process for the development of this guideline. It was highly participated, with a lot of participation of civil society, trying to obtain input from the communities and civil society, as well as the national ministers, programs, and the experts in the services. It also included a significant evaluation of the prior focus that you know of, the so-called Engaged TV, which are discussion groups, face-to-face and virtual consultations, and a directing committee was created, where it spoke of the civil society and communities' participation, who played a fundamental role in the whole process. So the document is a good combination of the expressions and the vision of the affected communities and the task force of experts and ministers. As I said, in 22-23, WHO held an evaluation of the Engaged TV worldwide and saw that there's been a lot of progress. But the main progress, despite some of the challenges, was constant expansion of the community services in response to tuberculosis, particularly in their community's participation in notifying the cases and the diagnosis, as well as the support for treatment. However, there were significant challenges that you see there, like the scarce institutional and management capacity of community networks, of course, insufficient investment in the community networks and the coordination systems. There was also community participation focused excessively on the services and not as much on the decision-making steps. And it was also seen that there was a lack of indicators that would help make a significant follow-up of community participation, and that when there was contribution or data, they were not used to plan the program. So based on all these results and all the analysis, we felt that some of the key aspects would include these new guidelines that would include the systemic approach, the focus on sustainability, aligned with the primary healthcare approach, with special emphasis on achieving an appropriate environment for sound participation of community. Of course, the question of financing, and significantly, the guidelines on how community participation can take place throughout the spectrum of the TB response. And it was also decided that there would include a new sector on monitoring and evaluation with indicators that would help measure the community contribution, not only involved in the services rendered, but in the more activity and broader services of planning the programs. And some of the main characteristics of the document include focus on community systems as well as the health systems, with what we call the single health system. And the community systems have to be seen as a complement of that single health system. And since the health system is a continuum, the community and backwards to the health, and the TB person should be placed at the center of this to break that fragmented vision of division between the two health systems and the community systems. Here you can see the representation of this unique or single system, the person in the center, and all around all the partners, the community, the health, the formal, the informal, all operating under that same umbrella, acting in the continuum, taking other sectors into consideration, the public and private as well. You know the influence of the multi-sectoral approach and how it helps in health. Some interesting information about the document is that it is brief, very careful in the use of the language, so that it is interesting for the ministerial programs as well as the communities and other stakeholders, with visual programs, a summary of important messages, so that it's easier to read. And an important aspect that they highlight is that all these basic actions and the contextual innovation is very important. It's key to achieve strong and significant community response, and that the community has to be seen as an expert as to their own needs at a local level, and they are the ones who actually can adapt their response to TB at a national level and adapt it to the local realities. We know that one single solution is not helpful for all, and this is important to achieve significant community participation. Very quickly, these new guidelines are not only aligned with the end of the TB strategy, they have also been aligned carefully with the WHO approach of primary health care and the vision of this approach. We know that we're in this era of universal coverage, and the vehicle to achieve universal coverage is precisely the primary health care approach. On the left, what you see are the three main components of this primary health care framework, fully aligned, as I said, with the end of the TB strategy as well as with the guidelines. There's three key components: integrated health services, empowerment of persons and communities, and all the policies and multi-sectoral actions. And a key point in the guideline is to bear in mind that community participation is not static. It has different levels, different degrees, different forms. And here you see in this slide 5 different levels of community participation. It is done in different ways. On the left, you can see that it starts with informing communities on activities or actions that will take place, and reaching even much more mature community participation levels. You see it goes consult, involve, collaborate, and the most mature level is when the community is fully empowered, capable of being self-sufficient, and able to create and implement its own solutions. We know that there are differences at these different levels in the countries and in the communities, but regardless of that, what's important is that we bear in mind that community services and systems and the health systems have a shared responsibility in translating this into practice, and that to begin, the first step would be what you see down at the bottom, listening and learning from communities, to have a dialogue with communities as a first key step, to listen and learn from the communities, for they are experts in their own specific context or local reality, so that will help inform and participate in the policies that have to be implemented. And that would be a key step to advance towards that significant participation. And here, another important step in the guidelines. Model was developed based on the cascade or route of care to tuberculosis, with examples of the whole spectrum of activities that are possible throughout this. You see here on the left, the healthy communities, persons at risk of acquiring TB but without active disease, activities that improve self-sufficiency, self-care. And in the middle, you see the activities for community participation that include facilitating access to diagnosis, supporting people during treatment, and in the third column, activities that could take place after treatment, such as helping with the disabilities related to tuberculosis, or maybe help with legal services, with migrants, for example. And sometimes communities are in a much better position to assume some of these activities. And lastly, to show you that we have in blue the cross-cutting activities that are actually essential, where community, civil society have much to contribute: advocacy, financing, monitoring, supervision, community supervision, contributions that could help the multi-sectoral accountability framework, the demand, and what have you. And another aspect that is highlighted as well in the guidelines is the community participation. But we want to underscore that we must speak of significant participation, that it be one truly active and civil society seen in an equal position, and that they don't just offer services or that they be consulted, that they also get involved in key program planning activities, decision-making activities, the development of strategic plans, and of course, the whole area of application and implementation of these plans in systems review and monitoring. And as we said before, this was what was seen in the review we mentioned at the beginning. Worldwide, a lot of it has been achieved with civil society's involvement in the implementation of services, but not as much in that significant participation.
So what we mean is a meaningful commitment to be played by the community in decision-making processes. And to achieve this meaningful engagement, there are three key elements that create a conducive environment. There should be a network of volunteers or bodies for coordination, such as what we see throughout the region through the different observatories on tuberculosis. This doesn't only work on the national level, but at the subnational level. Another key aspect is that there be sustainable financing, and three, that there be a legal framework, legal and political framework allowing for such engagement with the community. You can see in this chart, we have planning, decision-making, and look at this chart from bottom up, starting at the community level. The community would decide what its approach is going to be, but all under the umbrella of the strategic plan. We were saying that one of the weaknesses we have is that there aren't indicators worldwide to gauge this meaningful community engagement. We know that over the years, we've been using indicators 1 and 2, coordinating with the community for the provision of services. Indicator 2 speaks of how many people were successfully treated and who benefited from community support through that process. Now we're talking about some new indicators that will be included into the reporting system for WHO. One proposal for meaningful engagement is that we try to measure whether the representatives of the affected communities affected by TB actually play a role in the development of a strategic plan. Another indicator, number 4, has to do with funds, how many funds are allocated for community collaboration or engagement. We know that this is something that cannot only be gauged or measured with these indicators. So here's a checklist which can be helpful to see what aspects, what elements, what tools would enable us to gauge community engagement at the national and subnational levels. There's a special section that speaks about community-led monitoring, that is systematic feedback from the community seeking to enhance the quality of access to healthcare services. This contributes to the accountability mechanism. This is a process that should be led by the community in consultation with all of the health system partners, and it seeks to provide evidence about the very important areas that need to be improved upon, and that this contribution help to enhance the cycle of quality improvement so that decisions can be made ultimately to do just that, enhance the process. And it's very important to document and to disseminate best practices that are identified. This concludes my presentation. We are translating this into Spanish. We will send it to you once it's done. And this line of enhancing meaningful engagement of civil society is a priority area for us. We have been working with civil society throughout the project Observe, working with a coalition with a civil society engagement approach. We will continue to do the same. Later on, we're going to talk about the regional document we are working on community engagement opportunities and activities, in which we will be showcasing some examples from the region of best practices in community engagement. All this is theory, but we're going to now hear what civil society colleagues have to say about this, and we'll discuss it among all of us. Thank you. And I give the floor now to Marcelo. Thank you, Pedro, and good morning, everyone. Over the course of the next hour is to allow civil society to take the floor, to hear from those people who have worked in some of these different lines of action under tuberculosis, for the purpose of reflecting and thinking about this, not just based on the last high-level meeting and the framework that Pedro just referred to, the document, but rather focusing on the role of civil society in the region and in our countries to strengthen the tuberculosis response and to enhance the indicators. I understand that much work still has to be done. We have to make this final push to do away with tuberculosis. The executive director of the TB Coalition of the Americas and the Regional Observatory of Tuberculosis based in the US. Alberto, 10, 15 minutes at the most to hear your opinions and comments and your proposals about how we can continue to move forward. You have the floor. Thank you. Thank you, Marcelo. And good morning, everyone. Everyone in attendance at this very important event for us. Now, we heard about the theory, as Pedro said, about what we've done thus far. In all of the handbooks, guidebooks that are about to be released, these are mechanisms that civil society have been implementing for a long time now. Civil society engagement is baked in to the strategy end of tuberculosis under the Sustainable Development Goals, and the ministerial meeting also took that into account. We know what needs to be done. We know what we need, where we're headed, but what is exactly happening in our communities where we seek greater participation of civil society in this undertaking so that we can have the region of the Americas overcome tuberculosis. This is a region oftentimes overlooked, forgotten by international organizations, and there is a stigma worldwide, given the high burden of tuberculosis that the region represents, and that's a blight, as the World Bank sees it. Ours are mid to high level burden countries relative to our economies, leading to discrimination and stigmatization. Now, in civil society, we are also doing our best to ensure that commitments undertaken are compliant with, that are agreed to at the high level within the Sustainable Development Goals and the strategy of an end to tuberculosis. Now, bureaucracy is always a stumbling block because that limits the progress we can make. So all of these commitments taken on at the high level, signed on to by countries, need to be fulfilled. I'll be telling you about where we stand right now, what we've been up to, but most importantly, these numbers underscored by Pedro you can say that they represent tears, and there's a heart to these figures. You can say now, a young 22-year-old woman died in Mexico recently of TB, and just think of all the children left orphaned. I'm just trying to put a human face on these numbers. We need to take a look at the vulnerable communities left behind by the systems. These children who lost their mother are now orphans. And scant attention is being paid to them, to women, and to the children who are even that much more vulnerable in the region. Last year, I learned about or saw the figures about vertical transmission, by the child transmission of TB, and that left me quite concerned because it highlights the vulnerability of women and children. Now, this month, we have heard, and I'm following closely a case of a Venezuelan immigrant who is struggling to survive. We are watching his case closely because when talking about TB, we're really talking about saving lives, especially the vulnerable groups that we have in our region. And they deserve the attention to be paid to them, that care be given, that policies be crafted. Now, TB oftentimes, from a biological standpoint, we think of it as a vertical transmission, but there's also an issue of mobility across borders that we need to factor in to this equation. Another case that I've learned about from Colombia recently, this is the story of a Venezuelan migrant to Colombia. The Anchor Foundation shared this story with me, describing it. And so listen to this, because it represents many of the things that we need to do that Pedro talked about, but that we have not yet achieved fruition here. Now, it's ironic that on the World Day of Ending Tuberculosis, that this woman breathed her last breath. She succumbed to the disease that consumed her slowly. Her death should have been avoided. It's a bitter irony that shows that how the most vulnerable populations are affected by tuberculosis. This person is was a trans woman who was shut out of healthcare services that could have saved her life. Now, her story is a call to action. We can't continue to overlook or ignore the reality of persons affected by TB. We need to ensure there be universal access to health care for all people, regarding of their gender, origin, or any other condition. This was a trans woman, a sexual worker, and her case is emblematic, and we need to pay attention to it. Now, civil society has done its work in chronicling the pain and what communities are feeling and going through, especially the most vulnerable communities that don't receive the care they need, to take their voice to that meeting. Interviews, surveys were held. There was a parliament meeting in the Parliament of Panama, and a document was drafted. 5 points talk about very important matters: social involvement policies, accountability, financing, strengthening information systems on health in the community, training, development, and innovation, among others. These are the points, matters that we think, as we gathered, the community was saying, that needs to be disseminated. We don't want to go to the next meeting with the same methodology that we had last time. It's always a good exercise to see what was done right, what wasn't done right, but it's always also very important for us to make sure the community's voice is heard. One of the important aspects is democracy itself, the relationship between the foreign relations ministries and the health ministries. And this message reached the missions of the UN in New York. This process was chronicled by the group of 97, including most of the Latin American countries that didn't feel that they had been heard. And many of the people involved in these programs didn't take part in this movement. Civil society often says nothing about us without us. And so in the next statements, we want to make sure that the chiefs, heads of programs also, or that they not be the only ones taking part, but that the community also be engaged, involved. Now, one of my colleagues who's here with me, who was there, expressed these matters, stressing these points. And many of the topics that we addressed were indeed covered in the declaration, included in the declaration. There are 84 paragraphs in the declaration. And it's hard to boil that down to a definition, but some indicators relative to a clinical look at the disease were included, but there are some other points for which indicators were not created. That is, as raised by Pedro in talking about the results. There are 10 categories devoted to research and innovation, for which there also are not yet indicators. Now, we've, through the observatory, been trying to gather what countries have been doing, but we're too far behind, I think, Pajo, for following through on this process. We've been at this now for 7 months. 3 minutes left, Alberto. Despite the fact that we have to follow up and follow through on all of these points in these guidelines, but the ultimate strategy of an end to tuberculosis and of the sustainable development goal of doing the same, that countries committed to in this high-level declaration, we just have to make sure that they are fulfilled, complied with, and we are going to see to that, follow up on this from civil society, but this is a challenge. There are some activities assigned to civil society. However, we do need training programs, financing, with which to meet these goals and the expectations for meeting these goals, that public policies be fashioned. Social protection is some of the affected communities is very important, which I stated earlier. So, to sum up, in this path toward the high-level meeting, and asking the question, what is the value added by civil society? Just how much trust is there that we will get there? What cooperation, engagement, coordination with civil society needs to be carried out? And it all comes back to the same thing. If we want to engage, cooperate, coordinate together, and have the funds with which to do this, we need this level of trust to work hand in hand, not just, well, and that entails, just like we're doing right now in this meeting, passing the mic from person to person so that everyone can be heard. Thank you very much. Thank you, Alberto, for your words and for sticking to the allotted time. I didn't say it earlier, but at the end of the presentation, we are going to have an opportunity for Q&A comments. So please take down your questions, comments that you'd like to make, and we have set aside time at the end for that. We'll give you the mic at that time. Now let's hear from Ezio Tavora, who's a coordinator of the Brazilian Network of Research in TB and working with the community. You have a couple of minutes. Thank you very much for your participation. Thank you. I thank all of the colleagues from civil society, from PAHO, and the public at large. I'm going to start talking about something that I think is very important and that warrants our clarifying. To level set, so to speak. I'll be speaking in Spanish. I don't know why they're asking me to confirm what language I'll be speaking. Are we good to go? Can you hear me all right? Yes. I prefer to speak my Portuñol, my version of Spanish. I think that most people listening in speak Spanish. I'm going to make an initial observation that I think is very important from the outset, and also underscore some progress made in Brazil and then address the high-level meeting, the last iteration of it, and talk about the challenges ahead and how best we can move forward toward achieving those goals. Now, the first thing that I think is important to underscore is this concept of community system. This is defined in some international documents, was defined a little bit over a year ago, but it still strikes people as a bit odd. It raises some questions, doubts when this term was launched, released. Some comments were made, questions were asked. The community system includes churches and other civic organizations, but this isn't a term that's been fully fleshed out and defined. We're trying. This is, seems to me, an international idea we're still trying to get a handle on. We need to be clear. Not even the term civil society is fully clear. There's no real international understanding or convention as to what it means, and that's important. We have to define that, nail that down, so we understand who we are, how we can be identified, and how we can bring together more or less similar groups under this umbrella. Not all countries even have a healthcare system. Imagine community systems. It's not something that exists everywhere. So we need to organize civil society. We're talking about NGOs, international NGOs, community organizations, religious organizations. This is a concept that we use. Let's try to define this idea better. What community system means. Now, something that was very concerning to me, Pedro and colleagues, is that in the document, indicators 1 and 2 on community participation, these terms are medical. These indicators are medical in nature. How many people were taken to treatment by civil society organizations, NGOs, that offer this service? 2, the success of the treatment received. These aren't civil society indicators, these are medical indicators. And that is a big mistake to have these be the first indicators of to gauge the success of community engagement. Civil society interacts in different ways in policies, monitoring, implementation of those policies, offering services, helping those services that are being offered, but civil society is not responsible for providing the services per se. In Brazil, civil society does not play that role, and other countries, a number of other countries, it's the same thing. This is an obligation that falls to the government. So I think it's a serious mistake, error, that indicators 1 and 2 for community participation be these medical treatment-related indicators. I would say that's absolutely absurd. It's a big mistake. That needs to be fixed. The role of civil society is different. What does civil society do? It might also provide some services, but that's not its main role. Its main role would be to be a watchdog, keep an eye on what government does, to aggregate policies, to advocate for policies, but not service provision as its first goal. Like I said, that's absurd, that civil society bear the burden of the responsibility for the success or failure of programs, of interventions. I would say civil society is working very well, even when the services are awful. That's the dichotomy here. And so this document leads us astray, makes a big mistake. And so I think it's a wrong approach. That needs to be changed. I don't know what my colleagues think, but I think this is actually dangerous. It's the least I can say, because we're talking NGOs are having foisted on them the obligation of providing services. And I'm certain that my government agrees with what I'm saying, that responsibility does not fall to civil society. Let's talk about progress made. There are some very important things that took place last year among all the events held. You have what PAHO does classically, which is very important, which is to aggregate all of the program heads, bring them together, and to discuss progress made vis-a-vis challenges, policies countries have. That's very important that PAHO continue to do this, but it has to be more objective in how it does this, more targeted, to make sure that next year better indicators will be devised. So it does play a very important role. The other matter, in Brazil, at the TB partnership that was held in Brasilia in February, that was a significant event.
That was the launching of the CIEDS, which is the Interministerial Committee for TB control and other social determinant diseases, which was a work plan launched by President Lula with the minister and the general director of PAHO, who was in Brazil at the time, Dr. Jarbas Barbosa, as well as the WHO director, Pedro. and the head of the Global TB Program, Dr. Casa Eva. That was an important framework. We launched the work plan in Brasilia, and that was progress. And from there, we've had other steps where the government has advanced in having a working plan. Now there are three important items because there's this plan, which was launched in April of 2023. In February, what we launched was the work plan. And now the budget for the plan to integrate the services. And even more important now is that now we're beginning to implement this at all three levels. And there is community participation in that. The way in which community participation is going to take place is still something we're working on, but there is community participation. And that is important. Another fundamental framework which we mustn't forget is that in the state of Rio de Janeiro, progress has been made, and that was work done by the civil society without a doubt. It was work with the Legislative Assembly in Rio. It was many years of work. It was a very lengthy process of work with the parliamentarian system in the state of Rio. This is not at a national level. Esther, you have 3 minutes left. Yes, thank you. And the scope to use the funds from the state of Rio to fight against TB is work done by civil society. My colleague Carlos Basilia and many others from the Rio Forum are there, and their work was absolutely fundamental, and that's progress. There are problems, yes, but it's progress, and that is very important. There is another matter which has to be discussed, and it's the effect of the policies that are being implemented, and that's why the monitoring aspect is key. And we have to figure out how we're going to finance the monitoring actions because, for example, there is a long history of agreements between the Ministry of Health and the Ministry of Services that haven't even been implemented yet. There's money there since 2021 for the treatment. There's financial aid directly to purchase food for people living with TB in poverty situation. In the city of Rio, they're going to return 10 million reais, which are approximately $2.5 million, to the state of Rio because they did not accomplish what was expected. So it's the monitoring of those actions. What the affected people reach is fundamental because we're going to continue to hear very sad stories, as Alberto mentioned. So there's thousands of similar cases. If we're not able to ensure that these policies and discussions and what's in paper reach the affected people, we're not going to advance at all. And one thing we advanced in a lot in Brazil is with the fact that we had a lot of community participation in research. There's work with the TB network, with the federal government that work to expand preventive TB treatment is very successful in 5 countries, in 5 cities. We're going to extend it to another 3, all with national money and with investment in research from Brazil itself. And one thing I want to underscore, I'm losing the speaker, is that refers exactly to the fact that we have to go beyond that. This document should be read because it's an open letter of important researchers. That's a clear message saying that we don't have time to waste, that we must go beyond simple promises. We have to guarantee incredible, significant increase in Brazil in investment. in civil society actions as well as in research, which is very important. Brazil can set an example because it's a reality of important efforts that have been made by the government of Brazil. But we have to go beyond promises and documents. We have to go to actions and not hear so many sad stories of individual cases, because there's thousands of these very, very sad stories. So our role is to monitor action and not necessarily a rendering of services alone, because that's the responsibility of the government, that they provide universal access to persons affected by diseases. I apologize, Max, if I took a few extra minutes, but I'll end. Thank you very much. No, thank you very much, Ezio. I find your concepts are very interesting for us to talk to with the colleagues when time comes. So now I give the floor to Karen Rivas. Karen, as you know, is a former TB patient and member of the Colombia Civil Society. So Karen, you have 15 minutes. And thank you for joining us. Good morning to all of you. Thank you very much. I want to apologize. I have problems with my internet, so it makes my connection a little unstable. Thanks to Pajo and the civil society colleagues and all participants in this webinar. I think that we're at a very important moment of civil society involvement. I think that what's been said by the two colleagues who spoke before me is very interesting, but one of the ways I think we could achieve civil society involvement is recognition of their work vis-a-vis national TB programs in the different countries. And in that way, one could see how much we've advanced. Not only just mention the expectations, because the declaration of the high-level meeting is clear, the objectives are clear, civil society engagement is mentioned frequently, but how much have we advanced since this was brought up in the region? Even though we weren't considered the main problem of TB in the world, we do have the problem, and we have to deal with it. But how much have we advanced since we, as a region, decided to deal with the problems in the large cities? If we review, large cities was not enough for what should have been a response to the Engage TB approach, which is a compilation of the work that had been done in the past. Now, the new orientations, the new guidelines that WHO launched to strengthen the Engage TB work is a compilation of all the work of large cities, the compilation of the Engage TB approach to generate a greater impact now that we are in the eye of the hurricane, and maybe position civil societies in a better way. In all the countries, one of the great pillars is to renew the urgent strategic plan and identify the interventions that have to be achieved jointly with the programs, the institutions offering the health services, and that we as civil society be included in those actions that benefit persons affected by the disease. We must also think that, or consider, what's happening with the relapses, the recurrence of TB in people that have been cured. Are we really achieving the objective of curing these people and then neglecting them? After he took the last pill and declared as a person cured, what else did we do? How have we established our standards to care for these people, to make sure that they don't get the disease again? One of the things that we could think of is that we must select 100% of the people and not leave anyone behind. We have to bear in mind, what are we going to do with the persons that have the disease? I'm sorry, I'm losing the speaker. Persons in a vulnerable condition and the diversity so that their voices be heard as well, because we continue to say that it's usually these vulnerable populations, and we all have a certain degree of vulnerability. Actions of civil society develop differently depending on the laws established by the country. We all have actions generating interventions according to what we're able to develop, and this is evidenced in the different countries. The way to integrate and acknowledge civil society is very different. In Brazil, they have community work at the level of education and advocacy. But in other countries, we have the possibility of civil society being that first level that supports the treatment of the persons, to harmonize the work with the person-centered services, the primary health care services. And to achieve all that harmonization and all that action, we must generate plans that should become a mechanism for main approach targeted to the objective, tracing the affected persons, following up on those policies that are being formulated to protect the persons affected by tuberculosis. And we must also act as the harmonizers, as spokesmen regionally. I think that that's an excellent event, because several civil society actors who may be in the different countries could listen to what's being said and bring in those ideas to see what else we can do. And hopefully we have more of these spaces so that we can get to hear the opinions of others, which are so important, and then maybe come to a consensus. Another important thing is that we be able to validate the indicators Pedro spoke to us of coming from the new guideline, so that we are able to understand what we're going to bet as a country. Not all countries have the same problems. I mean, we all talk about tuberculosis, true, but not in not all countries is it in the same context, nor is it the same objective that we're targeting. But we must clearly understand what we're working for, what are we hoping to achieve, and what's the goal PAHO is hoping to achieve in the countries with their reports to fulfill the objective. Our great task now is to make the actions that are actually being done by civil society visible, because in the past they have been neglected in a way, because this was not included as an important thing. It would not give us a possibility of showing the work that we're doing in the civil society organizations. And maybe now we can become pioneers, showing significant changes in the region to the world, so that they can begin to take us into consideration as a region and see the work that we do for persons affected by tuberculosis. We must take advantage of the new diagnostic tools, the response tools, and continue to advocate to accelerate treatment and the new treatment schedules and the new treatment platforms, so that we can improve the indicators in the different countries. I, Marcelo, and colleagues believe that this is just one first element. We should continue to manage this dialogue and this aperture so that we can understand the concepts and the goals, so that we're clear as to what are those early interventions that are necessary, so that in a relatively short period of time are able to show the changes we're able to achieve in disease prevention and control, and also show the new alignments that we have in civil society with the persons affected by the disease, and for those of us who are continuing to fight for objectives based on what was decided at the high-level meeting. Thank you very much, Alberto. Marcelo, I'm sorry, she correct. Thank you very much for your participation and for your words. And lastly, we have Oscar Ramirez's presentation. Oscar has been a coordinator of the multi-country TVLAC program of the World Forum and is now part of the TVH program in his country and is responsible for the multi-sectoral and community activities. I believe, Oscar, that you have a presentation prepared. If you can share your presentation with us. Thank you. Yes. Can you see my presentation? Well, it's not in the presentation format yet. I think you have to click there exactly. Can you hear me? We hear you, and we now have the presentation. I'm going to use my 15 minutes. Okay, I wanted to show you, as part of the contribution, some of the recommendations to strengthen integration of community activities in the national strategies against tuberculosis, which could also be seen as challenges to strengthen the integration of these community activities. And this within the framework of the implementation of the Engage TB approach in Latin America and the Caribbean. The implementation was done in the Observe TB project, which was to strengthen civil society to help in the comprehensive response to tuberculosis. There were two key goals. The first, to consolidate the Engage TB approach in the Latin America and Caribbean region, and the implementation and consolidation of social TB observatories as a recommendation of the Engage TB approach as well. In this project, we had 11 countries who participated in the region. The topic we're going to present now is regarding Engage TB. As we've seen, Engage TB is a proposal, an approach presented by WHO seeking to change the approach to tuberculosis so that it's not be considered as a medical problem, but as a social and economic problem and a broader community problem. And Engage TB emphasizes in particular the value of cooperation and partnerships between NGOs and other civil society organizations and national programs of fight against tuberculosis. Engage TB, this is an approach that proposes 6 main components or areas: analysis of the situation, appropriate environments, guidelines, identification of tasks, evaluation, and strengthening capacity. We see the follow-up and evaluation, because that was the way in which, through the first indicators, and now we've seen that they've been expanded, evidence somehow of the collaboration of civil society, which has increased, fortunately. And now in some scenarios, I met with civil society and with the TB program authorities and asked, is civil society participating in this country? And everybody was saying yes, and in what cases, and they showed here and there and mentioned cases and incidents and support with help in the social protection programs, and they linked the social protection programs to others. And when we asked to what extent or how we could measure the collaboration, how much they contributed in identifying the cases and how many patients had been supported to ensure the success of treatment, and then most of the countries kept total silence. There was really no way of measuring up until then the collaboration. But we've always known that civil society has been actively engaged in different aspects throughout the TB process, from communication, identification, and care, and so forth. The implementation of the Engage TB approach gives you a series of recommendations for civil society as well as for the TB programs. And as these were achieved, one was able to translate the fact that the Engage TB approach was being implemented in the country where it was being implemented. Having ended the project, a checklist was applied based on the recommendations, developing interviews and focal groups in the different countries to see how compliance was perceived, asking for evidence as well to ensure that they had actually complied. We're not going to show any of the findings because we have, for example, the situational analysis, where we see the context in which the coordination between civil society and the TB programs was taking place, where it was shown the situation of TB in the country was shown, how care was offered, what was the reality of services in the health systems. The checklist included 5 questions, and it goes from 0, where nothing was implemented, there's no evidence, 1 showing that there is evidence and there's plan for implementation, 2nd, there is progress, and 3, highly implemented. The situation analysis, we see whether there's data of the tuberculosis available for NGOs and other civil society organizations. If the vulnerable populations have been identified and the mode of access have been identified, if they're using participative techniques to decide on the quality of the services, how could they identify the actors involved, and whether there was a mapping of all the organizations, NGOs or community-based institutions, academic institutions, research institutions, religious institutions that can in some way contribute in this struggle against tuberculosis, or who are working with the vulnerable populations, and whether they have been actually identified in the country. Promoting spaces for socialization and inclusion of data in the TB program and the civil society organization. We have the first results, that it went from 0 to 3. And these are the average results of the region. Maybe somewhat unfair for some countries, because some countries have some implementation and there are others that were just beginning to implement the recommendation. So on average, we have 1.7, and we see greater scoring in some places where there was space for socialization and discussion on relevant data for TB, which was something that we tried to include in the project. But we also see very low scoring in the collection of qualitative information to measure the quality of care in the health establishments. There's not much information about incidence, mortality, success rates of treatment in the different cases. But when looking for some studies or things that could help in the evaluation of the care, there was very little in the countries. The appropriate environment, which gave us the context within which the relationship existed, whether there was something standard, whether civil society was organized in any way, if it was grouped in some way in what was called a coordination body or OCO, or what we call the observatories, or whether each one is working independently, or whether one was only able to identify 1, 2, or 3 leading groups that are working in the country. Whether they had actually established, and we're going to give them not OCO but observatories, because this is what we decided, if in the observatories they established codes of conduct or guidelines with their own principles, and whether the TB program actually decides on a national policy that facilitates civil society participation in all aspects of TB, whether the representatives of the observatory meet regularly with the TB program to coordinate the activities and actions, and whether the civil society organizations, together with the TB program, are supporting in the growth and development of community organizations. There's a lot here, with a lot done with the larger non-government organizations or other institutions, and sometimes we couldn't find the actual support required to strengthen that participation of civil society and community organizations that seldom have the necessary resources to strengthen their participation, and often, as Alberto says, don't get the micro, or are they allowed to participate in some of these spaces. As to in the environment, we have an average of 2.0, because in most countries the observatory is 2.9, because most countries have already implemented the observatories and guidelines, but there's lack of policy to facilitate civil society engagement. As for guidelines and instruments, there's rules and guidelines to increase civil society participation, whether there are standardized instruments for civil society participation. We're talking about civil society engagement, and are there instruments, and what are the instruments used in the different TV programs, and whether these should actually also involve civil society activities understood by civil society, and civil society should also participate in preparing or developing some of these instruments. Is civil society going to cooperate? And we have encouraged that type of participation, for example, in the identification of cases, because often civil society, not only geographically, but because they're there in the community, and often reaches some of these key populations where it's difficult to access. We've often worked with them, strengthening their engagement, helping identify cases in their communities. And there should be validated tools in the program so that they can easily send the cases to the health center so that they can be identified initially by them. The inter-program cooperation between the TB program and the observatory has been formalized by signing a memo, MOU, or any other agreement. That's one of the greatest goals we'd like to achieve, so that each one establishes what their interests are, what are their points of coordination, what they're going to do together, and that they be respect with an MOU. As for guidelines and tools, we have an average of 1.5 over 3. Remember, there are tools. The tools have been developed. They have been standardized for civil society participation. What was missing was a validation of these tools in many of the countries. And the task identification. Here, it speaks of all the different opportunities. And from the experience of many countries, one was able to see that first, civil society is already actively engaged in many activities.
We couldn't tell them they couldn't participate. On the contrary, we just wanted to give them necessary resources for civil society to be able to take part. And if they were taking part in a good activity that turned out to be essential, referring people to treatment, then we needed to formalize and bolster that activity, not only to enable that organization to keep working, but to actually further promote those activities, endowing them with more resources. So NGOs, civil society organizations have undertaken an assessment, and together they have determined what tasks should be prioritized and carried out. A selection of these prioritized tasks has been made and worked into an application plan, implementation plan, and all the different civil society organizations have been mapped out to those who work in TB as their main activity. So it's very important to know what civil society is doing at the national, regional, national, and local levels. Here we have an average of 1.5 in that activity as well. Now, follow-up and evaluation. Data gathering instruments have been crafted and and notification systems for NGOs and other civil society organizations. It's been standardized and recommended at the national level. Indicators have been agreed to for following up on the execution of these community activities. Different electronic processes and systems have been standardized for the follow-up and evaluation of community activities. So there's a national information system that reflects explicitly what civil society contributions have been through community activities. It comes down to shedding light on civil society's collaboration. Even though this participation or engagement is strengthened in different areas, we're taken to outreach, advocacy. It was very important to shed light on what was being done in civil society. That is indicating cases and the referral to treatment for TB. Now, among all the countries, the average there stands at 1.6 for data gathering systems and notification or reporting. This information was shared and made available across TB programs, and the data from countries can be found in these different reports. And we see now that we can talk not only about quantitative but qualitative contributions that civil society makes in each country. Capacity building. We assessed the capacity building needs of civil society organization, and we expanded the community activities. Or in order to expand these activities, we looked into whether there's an annual plan for capacity building in civil society organizations. Partners in Health takes part in capacity building for civil society organizations through a training program with the engagement of the community and the community organizations that fight against TB. We have identified and invested financial resources to that effect. Here on that, you see 1.4. It's not that it has been identified, but sometimes resources have not yet been found, mobilized for these activities. Recommendations. And with this, I will conclude. About the implementation experience and the results in our countries, to carry out outreach activities to strengthen institutions by signing on to an MOU. Once again, it is very important that we not only motivate these planning activities, get the word out activities, but that there actually be a document crafted in which we can express what all the interests at play are that would benefit people with TB, and to engage a broader participation in these activities. All of this needs to be included in the MOU. What the relationships are going to be, what each party's contribution is going to be, and what each needs from the others. And so a joint civil society document on TB is very important. And also to include indicators that are crafted by civil society in the reporting system, not just the indicators. Right through number 4, I understand there are other indicators, and we have to find out who in civil society is actually taking part and where this capacity building or strengthening needs to happen. Monitoring civil society contribution at the national and regional levels with periodic activities to gauge progress made, develop, and push through plans of action for the implementation of the engage focus, to come up with standards, guidelines, instruments, or other documents that would foster greater community participation, to talk about capacity building needs and to propose capacity building plans, and to undertake different advocacy activities to mobilize, raise resources to make sure that these community activities actually continue. We've got the concept. We just need to strengthen civil society participation. There needs to be a better interaction between the TP programs and civil society, and we need to strengthen whatever activities they plan on carrying out. With this, I conclude. Thank you very much. Thank you, Oscar. Now, we can offer the floor to anyone. I would like to thank the four speakers. And to discuss the different approaches of civil society, engaging civil society in the Americas, what the approaches have been, as well as the different roles and functions that civil society can fulfill from different perspectives, outlooks, that this not be exclusionary, but rather inclusive or participatory. I would like us to be very to the point when we take the floor, to make sure that everyone has the opportunity to speak. And I would ask that we focus more than on relating experiences, which is something we will do later on, but because that is part of the presentation, to gather experiences in the region and then share that. But rather here now, where we stand, where we're headed, and what is the concrete response the region is standing up. Thank you very much, Marcelo. I thank all of the speakers who have summed up the main activities we need to take into account to strengthen civil society, meaningful participation. As Pedro said in the first presentation, the first step for meaningful engagement is to listen. So what is civil society's stance? What are the main lines of action from PAHO that can be taken by PAHO to follow through on this meaningful engagement of civil society? And raise your hands and we'll give you the floor in the order that you are asking your questions. I understand that Ruben is going to have a few remarks to make. I give the floor to Desi Gonzalez. You have the floor. Make sure your mic is open. Have you managed to open your mic? Good morning, and thank you very much. Good afternoon. All the presentations were excellent. I thank PAHO and civil society organizations for all your contributions, all of which were excellent. Now, as far as public policy, many countries are crafting laws, and sometimes they're engaged in a first or second or even a third debate. And in some countries, PAHO has offered meaningful support in the drafting of legislation, because all of the techniques of molecular biology, for example, is something PAHO is knowledgeable about, diagnostics approaches. It's very important for law to enshrine some of these matters. And I think it's important that civil society actually take part in this legislative effort, stay abreast of it, offer their input for it. When creating indicators, that type of participation is very important. So it is very important among the indicators created that we'd actually see what civil society's contributions have been. For example, in referring patients to treatment. Thank you. Thank you, Desi, for your remarks. We agree with you about the need for there to be a legislative framework that would help us translate these commitments to actually show a political commitment and make sure that these political commitments actually can be implemented. Working with civil society is going to be one of the lines of work by PAHO and WHO, and of course, follow-up needs to also be done to see to what degree this engagement is actually happening. Now, Peru has a law that was enacted over 5 years ago, a legal framework for TB. I only saw Daisy's hand up. I don't know if any other country would like or attendee would like to speak. May I speak? Yes. I agree that we do have to work with indicators, biomedical indicators. Now, also treatment and prevention. We haven't been talking much about prevention and conclusions, successful treatment. But we do have to separate because the biomedical perspective, that is where we all stand. It's very difficult to work on tuberculosis because the truth is, it's very biomedical. Now, the qualitative analysis and an approach that isn't exactly biomedical also has to be included. I'm speaking in Spanish. People are asking me again what language I'm speaking. I apologize for that. Now, what I would like to know is that we have to incorporate that. That is, qualitative approaches are more complex than quantitative ones. I think it's a matter of translation. It seems like they might be on the wrong channel.
We have to understand which perspective we should approach. If we are working in biomedical perspective, we are always going to use the same indicators, the same indicators as the biomedical thing. But as I said in my presentation, the services can be very bad, yet the communities can be working very well in terms of appointing or monitoring and showing that this is not working. For example, so this shows that we have to balance which approach we are going to have. So that's important that we understand that. But one thing that I have to underline, and that this has to do with my colleague's presentation, that this has to be flexible, and in terms of what each country can incorporate or can approach can incorporate in their policies, because every country has its own ways to go, and it's their own context. But one thing is, I think, is common sense, and we lack to focus on that specific thing. It's without incorporating in the national budgets funding to guarantee the community's participation in health policies and monitoring, or even in services. The local organizations, we will always be dependent on foreign funding. And foreign funding are not sustainable, because once the governments of the funder changes, the policies can change. If there is a war, I mean, where are going we to stand? I mean, even in the same government, things change. I mean, Brazil is an excellent example. How in 4 years the government of Bolsonaro destroyed so many things in health, and all the trouble that we are having to put that back together. So I will always, since I have been repeating this forever, that we need to guarantee that the countries incorporate in their budget funding to support the communities. In Brazil, we are finding the strategy. It's not a way forward. I mean, it's difficult. It's difficult to find a way to make that possible. In Brazil, by means of participation in research, I mean, we are having that. I mean, Brazil found, the Brazilian government is finding the way to more and more to fund that. But the working on indicators of quality, I really enjoyed the presentation by the colleague from Peru regarding the analysis that was done. But that is not clear how much is the investment. So these indicators of this can be very much quantitative, as my article letter to the Lancet. So we show that in 3 years there was an increase at least 200% in community investment, or 700 in research investment by the NTP. So we have to find ways to guarantee that the countries create their own way. It's not straightforward. I gave the example of the state of Rio. I gave the example of the Brazilian federal government. We have to make this effort in every single country. Otherwise, we will be eternally dependent on foreign funding, be that from the Global Fund, be that from bilateral agencies or private international agencies. We have to be in conditions to make sustainable policies. Thank you so much.
Gracias, Ezio. Le voy a pasar la palabra a Carlos Peña.
I'm going to give the floor to Carlos Peña. Thank you. Mr. Peña from Chile. The issue of, well, not everything can be done from the healthcare sector. We have to include the community. So as a first stage, we have to identify who the valid interlocutors in community are. So we have to know what each community organization can do, what they're for, so that we can open up access, unblock access for the community to be informed, for people to achieve some trust in these systems. We have to approach and draw closer to the community. There have to be indicators to that effect. We have to get the word out, disseminate this message. Now, we have identified our interlocutors, who are the representatives of society, and how and to what degree we can include the benefits that go along with tuberculosis. That is, are we going to bring down poverty, malnourishment, chronic diseases, so that we can improve everyone's health? Now, another very important component is to see to what degree social assistance is offered, who receives any type of work subsidy when beset by tuberculosis. The healthcare systems are recognized and have been, or to what degree people are a part or have access to resort to healthcare systems because they have a lack of trust, they're concerned about how they're going to be treated and so forth. So the integration in the healthcare system and working TB into it, we can't just address this as a one-off problem. We have to take a look at the whole of society's problems: drugs, poverty, alcohol, disinformation, and so forth, to invite other programs, HIV program, for example, and others to take part in this. This is a real social undertaking that has to be ongoing, not just a one-off activity and then wash our hands of it. No, this has to be an ongoing effort. And this is going to bring down the death rate because people are going to be diagnosed at an earlier stage, and that can be measured. And also to zero in on presumptive cases of TB and to use the rapid molecular tests. And that is something that actually people are going to like because they get the results immediately. And of course, if we roll out that test, then the likelihood of TB being spread by that person is reduced. And we can reduce the number of secondary TB cases. We can't just let people fall by the wayside, be abandoned. This is something that needs to be addressed. There needs to be some type of shelter for people with TB cases. There has to be someone that can be with that person, someone who can represent that person vis-a-vis the healthcare system, shepherd the person through the healthcare system. I think there's a lot that remains to be done, but we need to invite all of the healthcare partners to join in this effort so we can make more progress. Thank you, Carlos. I agree. The response to TB has to be a multi-sector approach, collaborating with all sectors. That's the only way we're going to eliminate TB. I give the floor to Ruben, then to Angelica. Dr. Ruben. I'm going to be brief. Thank you, everyone, for all of those excellent presentations. Every country has its own context for defining what community participation ought to be within the healthcare system. Now, extending the first level of care to the community, what was said in one of the presentations about that, that's indeed one of the things we would expect as regards governance. I think Brazil is a great example, has a great example on governance. When there's systematic participation, engagement of civil society through the federal, state, and some city health councils, I was told in one of the different interviews we held, and other countries could do the same to consider what the advantages of having such participation is, what the advantages are. Now, it's not always linear. One has their different processes. One has to be prepared for that. Now, the issue of trans populations is very important. At a meeting last year in Rio, one of the representatives of Peru presented on how the trans community is hit really hard by HIV and tuberculosis, addressing the different vulnerabilities that this group has, and within the context of the principle of not leaving anyone behind. Thank you, Dr. Ruben. I give the floor to Hala Hinao. Thank you. I thank everyone who presented this morning. This is a great multi-sector venue in which we can hear everyone's voice, and there needs to be ever more gatherings and venues like this. I'd like to talk about something that was raised earlier, which are the proposed indicators and the guidelines. Now that we are at a different phase of the community strategy. Now, timely assistance to achieve timely early detection didn't really involve civil society, the communities, and they should have a hand in this because we're talking about a shared responsibility of these vectors. We can't overlook them because this is a responsibility, certainly, first and foremost, that governments have, but I also commend the inclusion of these new indicators and also the importance of political outreach and garnering greater participation by communities in the response, designing policies and focusing on how such policies would be carried out and to come up with better strategies to enhance responses. Fundraising is important to strengthen community-led monitoring or oversight efforts where they don't already exist, and to strengthen research, implementation, and to do this in a qualitative way as well. We see data, we have all of the arguments so that we can make our evidence-based case for this based on our experiences, and not just bring all the experiences under one rubric, but to do so individually in each country, in each region, so that we can show that as a region, we can strive toward and achieve elimination.
So precisely, that's what I was referring to. And thanks for bringing this up, because it's not a question of eliminating the community practices of timely detection and therapeutic success. It's the support of many ways, including the social protection programs of psychosocial care and comprehensive care that the communities can offer. We, in these spaces, together with the political incidence aspect based on monitoring and research. That was all. Thank you very much. And thank you for this space. And I hope we can continue these through spaces for participation and engagement. Thank you. Doctor, you have your microphone off. Thank you so much, Ana. Thank you very much for saying that I was talking. And thank you for the contributions of all of you, and thanks to Hannah, I now want to give the floor to Angela Bijon. You have your microphone ready, Hannah? Angela Bijon. Oh, it seems she decided not to. She brought her hand down. So I see no further requests for the floor at this time. Oh, Eric Montayo, yes. Let's give the floor to Eric Montayo. And don't forget to unmute your microphone. Eric Montayo. Hello, can you hear me? Yes, we hear you. Well, I simply wanted to inform you of what's happening here in Bolivia, because I believe that several things have already been said. And above all, I'm curious to... No, it's not that I'm curious. I'm just something I think about, which is the question of coordination. I recall here in Bolivia, to see the economic aspect and the economic support, we have an institution here in Bolivia, which is the MCT. And it turns out that now in 2015, 2015, 2016, 2017, the strengthening of civil society organizations has also always been insisted on, and the economic activities that can allow them to do even more work. But what I wonder about is that we've practically gone backwards in my country in that respect, and I'll tell you why. Because though we do want to strengthen the civil society organizations, nothing has been done, because here only one organization is in command, and it's always been in the MCT, and it's practically taken over the MCT. And this question of strengthening civil society, economically speaking, has not been possible. And this is what I don't understand. Despite what other organizations have said, like Santa Cruz and Tacón and the Espada de Bolivia, I mean, we've been told that to strengthen, we're going to receive economic support so that we're able to offer better services or are able to give better support to the community, all within the framework of the interinstitutional aspect. But in fact, nothing has been done. In fact, one could say that the organizations have been set to one side in a way. I, as an organization, can speak, can say, but no other civil society organization is going to be taken into account. And this question of coordination, which is necessary to improve the statistical parameters and to reduce the number, is not there. That was what I was wondering about in my country. What's suggested in the program is not being done, which is the strengthening of civil society. And I think that that's what's necessary: coordination, strengthening the civil society so that the services can improve. We're not physicians. We can't improve the health services, but we can coordinate to help improve. For example, there is a program that is throughout Bolivia, which is health promotion. And that is to improve not only in the field of tuberculosis, but in all the different diseases. We know that the co-infection can cause problems, and the most affected in acquiring tuberculosis are the people with HIV. So we have signed an interinstitutional agreement with patients, the HIV patients. And we know that people with lupus can also contract the disease because they have low defenses. And we have approached that group to try to coordinate and improve the work as is suggested, because practically what we want to do is to reduce the statistics. But this is what I don't understand. Why is it said that coordination is necessary to improve? And here we're doing exactly the opposite in a way. Thank you, Eric. That is a good comment. And that is one of the lines of action of the organization, to see if we can advance towards the putting an end to tuberculosis with significant engagement. And we're going to be working on the implementation of these new guidelines in the country. We're going to give the floor to Melesio Maita and then to Angela Villon. Melesio, you have the floor. Thank you to all of you. And my gratitude to PAHO for organizing this very important event, particularly to allow us to speak of civil society and affected communities. And of course, thank you very much for the guideline you presented today, which is so important for the region, so that we can see how civil society can engage in the work that is being done to work with the problem of tuberculosis. What I'd like to highlight is the cascade of care, which as civil society organizations and persons affected by TB is one of the things that concerns us in the region. There's commitment from the high-level meeting, and there is a guideline for civil society engagement, which is something new, of course, but it is already being applied in other countries. What we would be very interested in is to see how we're able to reduce those gaps in the diagnosis, the detection of cases, and the implementation of the rapid tests, as well as the implementation of new technologies for the detection of TB, because what we're seeing in the overview of persons affected by the disease and all organizations that form part of this is that in most of the countries, the methodologies that are being implemented are receiving the support from international cooperation, which is the World Fund. But what we're not seeing is an actual commitment in the countries themselves in purchasing the equipment, the X-ray, and the team experts and things like that, because according to the balance that we're seeing here of what's being done, let's say there's 10 or 20 equipments in the different countries, but they have all been purchased by the World Fund and not by the country, with national funds from the country. And the activities that are being developed in different actions for treatment and recovery and dropouts and so forth and so forth, we're also able to see only the participation of the World Fund, but not the participation of the programs in the country. So I think that what has to be done is prepare maybe a table of indicators or a dashboard to see how we're advancing in these commitments signed at the high-level meeting that you mentioned, which need to be monitored as you suggested. And we in civil society are interested in monitoring to see how we're advancing, to see whether we can actually advocate and have the political incidence in our country so that these political commitments can be translated into greater financing, greater involvement of the community, and not just to say what has to be done and say what progress is necessary, but to actually be able to see what is being done with numbers, quality and quantity wise, and see what's happening in the region. Because what we're really concerned about is to see whether we're able to achieve these objectives of the high-level meeting. And the goals are very ambitious, and yet in the region we're far from reaching them. And if we see what's happening in our country, see that we really need to do more innovative things. Otherwise, we're not going to be achieving those objectives that have been set forth in the meeting if we continue to do the same that we've been doing this far. We need a lot of financing, and that has to be translated has to come not only from international cooperation, it has to also come from the countries themselves who use public resources to help in these programs nationally, regionally, and locally. That's very important to make sure that there is that type of intervention, and we have to continue to work on making possible the civil society engagement. Thank you very much, Melesio. And we agree wholeheartedly, financing locally is key to respond to the TB. And we have evidence in countries that already have it, and they've achieved the World Fund, but they've also managed sustainability and even expanded coverage of molecular tests in over 70% with local financing. We fully agree with you, and we know that we have to work on that to promote an increase in the local financing, which is key for sustainability in the countries that have received international help. And we are going to work on that to put an end to tuberculosis. And we're now going to give the floor to Angela Villon. Angela, good afternoon. Can you hear me? Yes, we hear you. Well, I'm from Peru. I'm the president of the Sexual Workers Association, and I also coordinate the national movement. The way I see it as a member of civil society, I believe we have the fact that the community of sexual workers has been completely separated from the fight for common objectives that we have. And we, all communities, the diverse communities, should work on this question of TB together. It's true that we are currently involved and following up on all the actions that are being done at the government level. There are many actions in which must be considered because there are many obstacles which not only are found in Peru, they're found throughout Latin America. For example, the mafia issues, which has flooded Latin America, bringing concern and precariousness, especially among sexual workers who are actually unable to do their work, and has pushed us into a very precarious situation. And many of our colleagues, and I would say thousands and thousands of these, have been forced to only have one meal a day, which places us in a an extreme vulnerable situation. And that's why the numbers of TB and HIV have increased. What's more, we don't have indicators, we don't have baselines, we don't have any studies because there's no national budget for them, because the migration has brought new problems, new figures, in fact. And we have to add to that the Latin American public policies, which evince a terrible step back. It's terrible because this is a fact we're living right now with new obstacles that we're facing, which in turn don't include the question of the interculturality, diversity, segregation of the different vulnerabilities, the extreme vulnerabilities. We're still fighting against stigma and discrimination. So we have somehow worked with other organizations, especially the TB programs here in Peru, that there have been very interesting proposals launched, especially because a draft bill has been proposed, which is 6376, declaring of national interest the vulnerability, so that we can have greater access to the budgets, because that would mean we'd be able to reduce the inequalities. It would also mean we'd be able to partner with the government itself to achieve these objectives. It would mean that we could work together. But as I said before, I continue to believe that the way we see it, we as sexual workers or persons living with HIV or persons living with TB should not have separate fights. All communities have to work together because the objectives are common, because they affect all of us. Thank you very much. Thank you very much, Angela, for this viewpoint. It's one of the lines of action of this initiative of not leaving anyone behind. This is work that we have to add to make sure that we don't leave anyone behind. And it is going to be taken into consideration, this question of support and strengthening of meaningful or significant participation. Now we have Lorena Ramon, who will probably, in this case, be the last presentation or comment. Lorena, make sure your microphone is unmuted and you have the floor. Good afternoon. Can you hear me? Yes, we hear you. Good afternoon and a greeting to all those present at this meeting, a very important meeting for us to speak of this topic, tuberculosis. I'm from Ecuador. I come from the province of Loja, the Loja Canton or section, and I work in the HIV and TB strategy. And what I'd like to share with you is the work that we've been doing since the last year with the HIV strategy together with TB, working in inclusive services, free of stigma and discrimination. And Ecuador, together with a partner we have, which is Kimirina, has been working since last year in specific topics of chronic communicable diseases, in this case of greatest impact in Ecuador. We're talking about HIV, we're talking about sexually transmitted diseases, tuberculosis, and hepatitis. And in this case, Ecuador nationally hired several work teams throughout different provinces in Ecuador. It's a multidisciplinary team with physicians, nurses, psychologists, laboratory experts, and a promoter. And what we're doing is reaching the populations considered key populations with our work. We talk about tuberculosis and HIV in the centers of people deprived of their freedom. We work with the sexual workers, we work with trans people, men having sex with men. And as I said, we do the screening of HIV and also identify whether the people have had the clinic or are respiratory symptomatically, have respiratory symptoms, and we talk to them about TB as well. This is something we began last year. We continue to work with this year, and the results have been good because we've also partnered with some of the sexual workers groups who are referring some of the users to our group for screening or for medical consultations, in this case, HIV and TB screening. We're going to the sites where this population meets. We're going to the different centers where they work. And I wanted to share this work that we've been doing in Ecuador. Thank you, Lorena. And we want to invite all institutions who are doing work like this or have this type of experience to respond to a calling that Pedro is going to offer of what civil society is doing throughout the region. Thank you, Lorena. Thank you all who've spoken. And as we said at the beginning, this is the first of many of these debates. And throughout this year, we're going to have several meetings because these new guidelines, this new guideline of the WHO has a roadmap, and it is important to hear the community because community are the experts, and we have to coordinate the solutions with the community, all these solutions to health problems. And one of the comments that we've heard throughout is that efforts have to be to integrate, to link with other issues like HIV, non-communicable diseases, communicable diseases, to take into consideration stigma, discrimination, the respect for human rights. All of this is a package, it's a comprehensive thing so that we can advance to achieve the elimination of tuberculosis. And through the email, we will be sending you a link with a form so that you can talk to us about your experiences, good practices, and the results of these, so that our regional document, which we will be releasing soon regarding community experiences and results, to help improve the rendering of services and the response to tuberculosis in the region of the Americas. I would now like to give the floor to Dr. Pedro Abedillo to end this meeting, to adjourn this meeting. Thank you very much, Belkis, and we want to thank you all for participating. I thank all the speakers, Antonio, Escobar, and Oscar, all the colleagues. Really thank you for enriching this, for making comments and questions. And there are many comments on the chat which we have made note of. And in particular, our special gratitude to Belkis, Marcelino, and Marcelo Vila, who have promoted this initiative with the civil society colleagues. And thank you, of course, to the interpreters. Unfortunately, we don't have any more time. We've gone 22 minutes beyond the schedule, but as we said before, and as Belkis and Karen have said, this is just the beginning of this discussion. We have seen some progress, as we heard from Oscar, and we heard the comments from the different experiences in the region. Very important work that's being done in Brazil, for example, and all the work with the Engage TV and the World Fund. But there's also many challenges that prevent us from achieving that significant, meaningful participation, and how to measure that so that we can actually see where we are and how civil society or community participation is. We see that the question of the indicators was relevant, and I believe that it could be important in the region that we review the WHO indicators, and maybe they might also help us advance in maybe reaching some regional goals of civil society participation and engagement. And that could give rise to achieving those plans or guidelines or roadmaps that Ezio spoke of country by country, so that we can identify the gaps and work with them. We've also seen work being done in all the other different aspects that Oscar mentioned, but insufficient to maybe have the appropriate way for active engagement. And I wanted to clarify something which was said before, and I tried to show it in my presentation, that we do see with the new guidelines of the WHO that one of the key aspects is to strengthen civil society participation and community participation, not only in the implementation of services, but that we have meaningful participation at a different level in advocacy and an important role in decision-making. I just want to rescue or speak of some of the questions. We spoke of integration with other diseases. Alberto, in fact, shared in the chat a document that we prepared some years ago with civil society representatives of different diseases, TB, HIV, hepatitis, sexually transmitted diseases. And it was an exercise where we tried to find different cross-cutting lines of action, which are not specifically only for tuberculosis, I should say, but that are much broader, include things that would help us approach the primary health care and universal coverage, which would also be interesting, and see whether we can work with civil society and other diseases to work together with them. And we've had Rubén Mayorga with us, whom you know is the senior PAHO advisor on civil society participation in the elimination of communicable diseases, which would be an important thing here. We want to continue with spaces like these. We want to see how we can continue to facilitate programs with participation with other programs. We have a lot more to talk about. We have to work more to really find the appropriate lines of action that could help us work with the region. And as Belkis said, we're going to send out a calling to compile experiences. And we believe that these are experiences of all aspects of activities done by civil society organizations, things that they can work with. And it will be interesting for the document that we want to release soon. But we'd also like to have a compilation of all good actions in the region that we can announce or publicize or discuss about, to see how we can advance in all these different fields. So as I said, we're going to stay in touch. We want to continue to hear from you and hear your comments. And with this, we'll end our meeting today. Thank you all very much, colleagues, and have a great rest of your day. Thank you very much.
Hasta la vista. ¿Tomaron foto?
Uy, se nos pasó la foto.
Quien pueda todavía con cámara.
Cámara,
Ah, mira qué guapos. Belki, ¿estás tomando? Porque hay muchas pantallas, creo.
sí hay muchas pantallas, ojalá lo pueda hacer correctamente.
Oh, si no va a quedar grabado de todos modos.
También.
Sí,
Ahí se toma una bonita. Para mandar los tweets.